Hey guys, my name is Mavi and I've spent the last 14 years in the plastic surgery and beauty industry, working alongside some of the best plastic surgeons in the country. Now I don't work for anybody, so I have unbiased opinions about hundreds of surgeons from across the world, and I can help you achieve the body of your dreams. Hey guys, do I have the show for you today? I'm super excited to have Dr.Steven Williams and Laura Alexis from Pop Recovery Systems on the show today, and we are going to have an amazing show. Let's start with something super interesting. My listeners, my girls know that I'm always trying to bring them the most information, the top of the line, really, of like, okay, let's find an answer. They know if I don't know the answer, I'm going to find an expert and we're going to figure it out and we're going to get to the bottom of this. So today, I think it's a really awesome opportunity for us to really deep dive into the patient journey. And I saw, Dr. Williams, in your podcast prep that diversity is something really important to you. So I really want that for you to share with us. What does that mean to you?
Yeah, so great question. As a plastic surgeon, when we think about diversity, we want to make sure that all of our patients have access to the best healthcare, the best decisions, the best techniques, the best surgeries. Really what it is it's about making sure that everyone has an equal playing field in terms of access to healthcare. And plastic surgery, a lot of times people think about it just as kind of the aesthetic cosmetic part, but there is a lot of medicine, a lot of reconstructive procedures we do. All those things are really important. And as your listeners know, aesthetic surgery is actually a very large part of self-actualization and well-being. And so when I think about diversity, I want to make sure my patients have all their questions answered. We want to be an easy place for people to get really good information about plastic surgery.
I love that. Laura, how do you see DEI in your industry?
Well, I think that one of the things that my particular demographic of being a Black woman that we don't see enough is credible and safe information from board certified plastic surgeons that we can relate to. So they'll be maybe our demographic speaking about surgery, but they're a cosmetic surgeon and it's a $39.99 BBL special, Vixen body that women like myself, a professional African-American woman, that's not the look that we're going for. So I would love to see more of that. But one of the reasons we created the systems the way we did and have so much diversity within our company is because we want to be able to shadow and be a mirror for our patients to say, like, we're going to help you find what you're looking for because we know there's a need out there. Like there's not enough Dr. Williams out there. You know what I'm saying? It's what it is.
If I can just augment that, Laura, I really, really appreciate you, taking that position and really advocating for, the people that you're working with and the people who come to you for answers. And sometimes as a board certified plastic surgeon, we feel like we say it all the time and we feel like maybe it's not being heard, but it is really so important because those caregivers, those people who are trying to get patients to their journey safely, we're the ones that have the ethical obligations. We're the ones that have the continuing medical education. We're the ones that are going to stand by you postoperatively. We're not going to put you on a plane and say, well, thanks for the $39.99 for your BBL and good luck. We really, and a lot of times we're the ones that are responsible for fixing other people's problems. And so we really care about patient safety. We really want our patients to do well. And I really applaud you for taking some leadership and moving forward to protect patients and advocate for excellent care. So thank you very much. I just wanted to jump in and say
No, thank you. I appreciate it. It was one of the things that probably irritated me the most as I first started discovering more and more was my own women, my own people just kind of being guided in the wrong direction because of lack of information. And it's like the board certified plastic surgeons are held to certain ethical standards, but the cosmetic surgeons are not. So I felt like we needed to create some type of third party like space where they can say, okay, well, what does Laura Alexis say about it? And that's what I'm trying to create alongside Mavi.
I think it's even more important now. I mean, your timing is perfect, and we're really in need of systems like what you've developed because social media is only becoming more and more powerful. And as you said, our hands are a little bit tied about the things we can do. And when we think about how social media works, it's really this currency of outrage and of unattainability and of shock. And those are the things that do better. And those are the people who get more attention. And as a board certified plastic surgeon, I have to say things that are truthful, and I have to be honest with people. And sometimes that doesn't do very well on the algorithms. And so, as a plastic surgeon, we know our voices are actually less on social media. And the voices of other people who are maybe not doing things as ethically are louder. And that's how people get hurt. And so, again, second round of applause for you really kind of, being out there on the forefront and helping us to get the message out. Thank you so much.
It is something that has been very important. I feel that's how Laura and I aligned ourselves with each other, because with this show, the mission was women are getting hurt, and how can I help women stop getting hurt? Because I worked as a patient coordinator, and I started to see the injuries from the other surgeons who were not really supposed to be doing this surgery coming into the office, and the lives of those women just completely altered forever. And it shocked me so much that was the mission. We have to get out there. We have to share the good information. And I had an episode about this season, but I really want to appreciate and take advantage that we have the sitting president of the American Society of Plastic Surgery on. And why don't you tell us a little bit about and educate our audience about the different types of board certification, as far as like board eligible, board certified, and board certified cosmetic surgeon.
Yes. And so this, again, is something that I feel like I kind of say over and over and over again. And sometimes we forget how important it is to say it one more time. And so I'm really happy that you asked me that question. The way to think about it is there is an organization that manages who should be doing what in all senses. In America, doctors aren't restricted from doing whatever they want, which is a little bit weird. It has to do with kind of fair trade and some of the economics. But an OBGYN could do brain surgery. I could deliver babies in my office if I wanted. That's not illegal. It's a terrible idea, but it's not illegal. And so the American Board of Medical Specialties organized to certify specific portions of medicine. And so there's board certified pediatrics, there's board certified OBGYN, there's board certified orthopedic surgery, there's board certified plastic surgery. There are a list of official certifications that this board maintains. Now, within each of those boards, there is responsibility for conduct, being honest, being ethical, being well-trained, continuing medical education. And to become board certified, they're all a little bit different. But in plastic surgery, you have to obviously finish medical school. And then you have to go to a certified plastic surgery training program. You have to graduate from that program. And then you have to take a written exam after you've graduated. And that doesn't count all the written exams you had to take to graduate in the first place, but you have to take a written exam about a year after you graduate, and you have to get a certain score on that. Once you get that score, then the board starts collecting all your cases, meaning that every single case that you do, they want to look at. Every single case that you see, they're reviewing your pictures, they're reviewing your pre-op workup, they're reviewing your results. And it doesn't mean that people can't have complications, but they want to make sure that plastic surgeons who are going to say that they're board certified are managing those complications appropriately, that they're being honest, and they're not setting themselves up or their patients up for disasters. And so the board then gets that year and a half of cases, and they look at every single case, and they say, we want you to come in, and we're going to talk about these 5 cases. We want to see what you were really thinking on these 5 specific cases. And then they say, and we're also going to have 5 that we're not going to tell you about, that test what a plastic surgeon should know. And so after you've passed that written test, you have to travel to Phoenix. It's usually in Phoenix once a year, and everybody gets together. And if you want to see a bunch of nervous young plastic surgeons, that's the place to see it, because everyone's walking around just reading and studying and just super nervous, because it's a really important process. It's a 2-day test. And if you pass that, then you can say you're board certified. After you graduate from plastic surgery residency, you can say you're board eligible. But that eligibility expires after a period of time. If you fail the tests 3 times, you are no longer board eligible. If you wait a certain amount of time, I think it's about 8 years now, you are also no longer board eligible. They say, look, we gave you a shot to do it and you can't do it. The whole point is this is designed to assure the optimum level of patient care, that only the best, most ethical people are doing it. Again, it doesn't mean that these people can't have complications. It means that you have the lowest chance of having a complication with one of us. And it also means that if you have a complication, we're going to stand by you and we're going to figure out how to get through that together. Now, your last point about other board certifications, this is where it kind of gets messy. And I'm sorry to kind of be on this soapbox.
Get messy, Dr. Williams.
Okay, all right. This is what kind of drives me crazy.
Yeah.
And so, as I mentioned before, if I wanted, I could be delivering babies in my office, right? Now, a hospital won't let me deliver babies at their hospital because the hospital says, wait a minute, what is your board certification in? We're only going to let you do what you're board certified in. So we know you want to deliver babies in our hospital, but we're not going to do it because you're going to hurt somebody most likely. But in your office, if you build a little surgery center or a little surgery room in your office, you could do it. It's not illegal. It's a terrible idea. And the reason why you don't see plastic surgeons saying, I'm going to deliver babies, is because there's not financial incentive. And again, you said get messy. Well, I'm going to get messy.
Mm-hmm.
Yeah.
The reason why other doctors are saying I'm a cosmetic surgeon or I'm board certified in cosmetic surgery, which, by the way, there's no official board certification in cosmetic surgery. The reason they're doing that is because there's money in it. And because, especially with social media right now, they can convince patients that, hey, you should come to me, give me your money. And I'm not really trained to do it. I'm really a general surgeon, or I'm really an ER doctor, or really an OBGYN. But I'm not going to tell you that. I'm going to tell you that I spent $200 and sent a check to a PO box, and they sent me this fake certificate that's on my wall, and I'm board certified as a cosmetic surgeon. And so it's all about, in my opinion, fooling the patient a little bit, because why don't you just be honest about it? Why don't you just say, well, I actually went to medical school and I did a residency as an OBGYN, and I just didn't want to do that anymore. And so now I'm doing cosmetic medicine, but I'm not really certified in it. Patients can make that decision, but there's a lot of dishonesty and fooling people because they want the money. So now I'm going to get off my soapbox.
I feel like if patients know, like this is why it's so important to educate. You're so right, because if patients know, and this is the stance that I've taken, they'll make their own decision on who do you want to cut you open? Who do you want to cut you open and make sure that you heal perfectly and everything goes great and you don't have an infection and you don't have any type of complication?
As you know, as a patient coordinator, and as Laura knows, because of the POP recovery systems, having done all that work, there is a lot of people trying to trick people, again, in my opinion. And as a plastic surgeon, I'm okay if a patient says, look, I have made an informed decision and I know that he's an internal medicine doctor, but I've seen his results and I've talked to him. I just feel he's the right person for me. That is 100% okay. People have the right to make that decision, and I advocate people making informed decisions. But it's not fair when patients are lied to, and it's not fair when there are these kind of fake boards. And there's only one reason to have a fake board. It's to kind of fool people, and it's really unfair, and it's something that, as the president of the American Society of Plastic Surgeons, I really strongly advocate. For patient education. And I know you guys both do too. So again, thank you.
We do.
I am floored about this fake board. I am literally going to be researching that and creating a dozen reels just about that subject, because I don't think that anyone knows about it. I don't think that anyone knows that it's actually not a real board, that it's just a made up, not the average client, and a lot of times with these, internal medicine doctors and all of this, one thing I think that they're tricking them about the most is by offering such a low bottom line price. And then comparing what they do to a board certified plastic surgeon and kind of saying like, we're going to give you the same result. Why would you pay so much more? And so that's why I think this education is so extremely important, because someone like me 2-3 years ago, You know, I wasn't looking for the cheapest, but I certainly wasn't educated to know enough that if this, because there's cosmetic surgeons out there also charging the same as board certified plastic
or
surgeons.
more, or more.
Well,
So
again, as they get more power on social media and as
Yeah.
their influence, becomes larger, they have that power. And I think 15 years ago, 20 years, again, I'm an old guy at this point. Before social media was really this powerful, I think it was a little bit more contained because it was harder to kind of get that message out. But
Yeah.
now, if you're able to really kind of blow up and get a lot of attention, you can really, again, in my opinion, fool patients about what you're really trained to do. Again, it doesn't mean that if you're an internal medicine doctor, maybe you're one of the most amazing liposuction surgeons around. Do I think that's likely? No, but
No. I was about to say, you're so nice, Dr. Williams. You're being so nice.
but maybe it's possible. But physicians should be honest. And, the last little thing I'll say about social media is, that transition from 15 years ago to now is really apparent. And the way to think about it is traditional media lies have consequences. And the way to think about it is think about Fox News and think about Rupert Murdoch and the whole, election thing. And again, I'm not being political, wherever you land, that's totally fine. But it was clear that the whole Dominion voting machine thing was a lie. And this was promoted on traditional media. And lies have consequences on traditional media. And it was an $800 million consequence. And that's the tiny lawsuit. There's a bigger one coming. And, that really kind of changed Fox's direction a little bit because they're like, whoa, we have to be a little bit careful if we're going to be spreading these lies and saying that it's the truth, there are going to be consequences. None of that exists on social media because of Section 230, which is a U.S. regulation that allows platforms not to be responsible for what's posted. You can say whatever you want. And that really has perpetuated some of the less ethical providers saying whatever they want, promising the moon. And, patients fall for it not because they're not smart and not because they're not doing their research, but because these people are spending an enormous amount of time, energy, effort, and money trying to fool people. And a lot of times they're getting away with it.
With wordplay. It's a lot of wordplay, a lot of, let's touch on this subject. The new wave of before and after pictures that it's social media. They're social media driven and they're posted on social media and they drive all of this attention and attraction to certain surgeons. But when you really look at the pictures, they're all dressed. We never see a scar. We don't know what does it look like under there.
Those are the good ones. The bad ones are the ones that have been photoshopped. And, again, if a plastic surgeon did that, they would be in serious trouble. We are not allowed to retouch our before and after pictures. They have to be honest representations of what happened. And in fact, especially amongst most of the societies, we're actually supposed to not put the really good ones up. It's supposed to be representative of what your work is. And so, there's there's that ethical ceiling that we're happy to be held to. I'm not complaining about that. But the guys that aren't doing it right are not held to that. And they're photoshopping their results and they're saying this was a 2-day recovery or this was, this patient had, she spent $500 and had a mommy makeover and did great. And you look at the picture, you're like, that person didn't even have surgery. Some of it's amazing, what they'll kind of promote. And it's going to get worse because AI is going to actually make these algorithms more powerful. It's going to get easier to fool people. It's going to get easier to Photoshop and, make changes. Before, again, old man, 10 or 15 years ago, you had to know a little bit about Photoshop to actually successfully kind of use that liquefy tool and move things around a little bit. Now you just tell AI to do it. And it's only going to get more powerful.
I 100% agree. I love AI. I'm at the forefront of the AI revolution. So I am excited about it, but I also know that it does come with its repercussions and we have to be very cautious with how we use it. But I want to talk about pictures on the table. What's your opinion and why do you think that pictures on the table are misleading?
Yeah, I don't I don't personally post pictures on the table, especially for BBLs. And the reason why is because, and we've all seen them, right? It's like that kind of like everything's like shiny and that is a very carefully curated photograph, right? It takes a good 3 or 4 minutes to set up for that photograph. And the reason why I don't feel it's particularly helpful is because everybody's butt looks bigger on the table than it does at the end. And what patients really care about isn't what they look like under anesthesia on the table. They care about what they're going to look like in 6 months or a year. And so I think those pictures are much more representative, and those are harder to find because everyone looks smaller afterwards. Anytime you do surgery, there's swelling. And again, these are the ethical people. I definitely know of cases where people have injected saline and things like that probably aren't going to be harmful, but can really make a difference in how things look. The doctor knows that that's going to go away, but they're trying to get that great before and after picture to trick more people. Mm-hmm. And so, and I'm not saying that, I'm not calling anyone out specifically, but I don't think it's a very helpful picture in terms of making decisions for patients. I think that kind of those longer term follow-up pictures are more important.
Absolutely. And let me tell my girls why I think those, or why we think that. For me, one of the most important things is at 6 months, we know how that incision looks. We know how everything's healing. So to me, looking at an incision at 6 months is way more important than looking at a before and after on the table, just to see how does this surgery heal. What do you think? Or what do you guys think?
No, I mean, I agree 100%. And I think that one of the biggest tools that the patients find helpful in the recovery system is that concierge wellness coordinator who tracks down those photos and tracks down that information that isn't easy to find on social media, because unfortunately they are under the pressure of knowing that 6 month before and after, though it's the most important, may not get the most likes or may not get the most engagement on social media. And so, then you take that to a type A, very busy person who's going to spend days and weeks and years and hours trying to find a 6 month photo. And even going into a surgeon's office, I'm kind of more thinking about how do I feel with the surgeon. I may not even think about, hey, can you show me some of your pictures from 6 months? So it's like, that's why it's so important, Mavi, what you do and what our team does, because there's just not enough time in a day to do exactly what it takes to find the right surgeon for you, board certified. The fact that, I just learned so much from you, Dr. Williams, about the fact that board eligibility, it's not really something that you have to strive for. It's once you strive for it, don't get me wrong, but you graduate, and
you're automatically
and then you're board eligible for like 8 years. So that means that somebody can be just dancing along like I'm 8 years eligible. You know what I mean? I think that that's crazy.
It's a little bit, and Laura, you're exactly right. It's a little bit weird to, to be talking to a plastic surgeon who's more than 4 or 5 years out that isn't board certified. It definitely takes 3 years to get there because, again, 1 year for the written and then 2 more years for the oral. But year 4, year 5, you should be board certified unless you failed. And again, someone who fails the board exam doesn't mean that they're a bad plastic surgeon, but it means they have a little bit more work to do to get up to the standards that are expected. And again, most patients, and I think you mentioned this a little bit earlier, a lot of times price is a factor. And, I'm not trying to downplay affordability because that is a big driver in terms of access, in terms of people's decision-making process. But, it's your life. And you don't want to have saved a few $1,000s, but not be there for your children or not be there, in the future. And so, it's really an important decision, and it's hard. It's getting harder and harder to kind of parse, who's being honest and who's not.
I want to tell my girls, because I always like to tell them what I'm hearing, what I'm seeing, and why we're even talking about this. One of the things that I've heard that's happening down in Florida at these, I call them chop shops. At the chop shops is that there's one surgeon who you're meeting and who is selling you the surgery, who's telling you that they're going to be the one doing the surgery. But then when they roll you into the back, it's not that surgeon gets the surgery started, but it's not him or her completing the whole procedure. And I heard that from like surgery techs who are like rotating in the room, and they told me the corners that are being cut, because when we talk about pricing and the price difference, it does not make sense that in one place a BBL costs $15,000 or more, in another place across the country it costs $3,000. Like, where is the price? What is this huge price difference? Where are the corners being cut? I understand why the plastic surgeon or the higher price is, because we're taking into account all these different types of fees, right? Hospital fee, anesthesia fee, all of these different fees that we're adding onto our quote. At these surgical facilities that are, I call them the chop shops, they're not having all of these additional fees. They're doing your surgery in their office, in the back room somewhere. Sometimes they don't have anesthesiologists. Sometimes it's the surgeon doing the surgery, doing your anesthesia too. Sometimes they're cutting corners by reusing vials that are one-time use. I've heard from techs that are in the room that there's still lipo fat on the floor when they're rolling in the next patient, because there's not enough time in between to really clean the room. And those are things that a patient would never know. A patient would never know that.
There are some, and Mavi, again, I think you're really calling out a lot of things that are the darker side of kind of what happens out there. And one of the things patients can really do is, when a patient is looking for a particular service, you should see the doctor. Like before, when you go to the office, you should be having that conversation, not with a patient coordinator. And again, Mavi, I'm sure you're very good at your job.
But I'm not the doctor. And it's always, you have to get with your doctor.
Right. And so it shouldn't be the front desk person or the patient coordinator or the nurse. It should be the surgeon, because no one else is going to be able to explain, what the plan is and come up with the right course of action for you. And then secondly, the surgeon you're meeting should be with you the whole surgery, and again, sometimes, when they're putting the dressings on, or the PAs or nurses are just kind of getting the drains adjusted, fine. Sometimes we're checking out the next patient. But for the critical portions of the surgery, the surgeon should be there the whole time. It should be the surgeon that you meet. And you should meet that surgeon. You shouldn't meet them the day of surgery, because just like both of you said, when you're meeting that doctor for the first time, there's a lot of things in your head. You haven't had that chance to say, okay, here's my second chance to talk to this person. And I didn't ask the first time, but here's what I'm going to ask the second time. Those multiple meetings are really important, because meeting doctors, it makes people nervous sometimes. And so those are big warning flags. If you're just talking to someone on the phone who's like, yep, I'm going to book you for surgery and you'll meet the doctor the day of, whoa, that is a major, major warning flag. And then again, we definitely have some concierge services. We definitely, because I'm a known name and I'm the president of ASPS, we definitely have people who kind of fly in sometimes, but those patients need extra consideration and extra coordination about their postoperative care. And it has to be something that's talked about in advance and that we have a plan, because what we prefer patients to be here so we can see them, and I can make sure my PAs, my nurses, and myself are seeing these patients to get them through the process safely.
Absolutely. I think that's really important. We always talk about the importance of following up with your surgeon, especially when you're starting to see something that you're like, this looks a little different. That's when you need to go, hey, hello, surgeon, let me send you a picture of this, because it kind of looks different. Because to you, or even something that you might not even notice, your surgeon might pick up in your follow-up or in a post-op appointment and be like, hey, this might bother you later on down the line. Let's go ahead and address it. For example, a dog ear, which we know dog ears happen. Sometimes some surgeons don't get them. Some surgeons get them all the time. It happens.
Everyone gets them once in a while.
See, so when you're doing your follow-up appointments and your surgeon sees it, he's like, all right, let me fix that. So that's the importance of those post-op appointments, because you're seeing your surgeon, but your surgeon is seeing you and checking everything on you and making sure that you're healing right, that you're headed in the right direction. So those post-op appointments, you guys, please do not skip them. I know y'all do. I've been there. I've been listening to you say, oh, do I have to come? It's 3 months post-op. I feel fine. I know y'all are trying to get out of it.
because so we have like two sides. We want to be able to show that there are board certified plastic surgeons within a 45-minute hour radius to the patient so that they can be more inclined to make their post-op appointments and all of that. But really, we were founded because of our first practice had 70% out of state patients. Yeah. And we're like, how do we can extend the care that we want to give them when they're all the way across the country? And so being able to partner with the patients in a way and the surgeons in a way that their protocol is continuing to be enforced once the patient is home, we have seen that make a huge difference. And also the patients are different, they're different with the surgeon than they are with their nutrition coach, their mental health coach, their concierge wellness coordinator. They tell them a little more things than they would tell their surgeon because they're always like, oh, he's so busy or she's so busy and we don't want to bother them. And we have to tell them all the time, like, they want you, if there's something wrong, to bother them. It's not a bother.
Yeah. Again, Laura, I think it's a really, really great point. And I think, again, what you've built is, it extends our capabilities. It extends us being able to take care of patients safely. And I think as long as there's that connection between the postoperative recovery team and the surgeon, and as long as we're always available to you, and that you're that conduit for patient information, super, super positive, and I think really, really powerful for patients. Absolutely.
We love it. Laura and I have been hand in hand at trying to see how can we make this the best experience for all of our girls, all of our clients, everybody that is on their plastic surgery journey. Like, how can we make it as easy as possible to help them stay safe and still have amazing results that change their lives and catapult them into the next level of their life. I want to touch on something that you said earlier, Dr. Williams. You said that people are realizing that surgery is actually the next step in self-actualization. I really would love for you to touch on that.
Yeah, the most powerful thing that we all have is control over our own bodies. And again, I'm saying that as a Black man whose ancestors didn't always have control over their own bodies, right? And so it's obviously a very personal thing for me, but it's really empowering for patients. I remember a story of a nurse that I worked with for over a decade. I've known her, and she was an ER nurse, and every once in a while someone, be a dog bite or some child would fall off the bed and cut their lip, and they, Dr. Williams, you come in, we've got one for you. And I'm like, yeah, of course, I'll come in, we'll take care of it. And she was always like one of my favorite nurses because she was so positive and always there for the patient. And, she was just a really great person. And then she kind of left, and I'm doing less ER stuff because I'm kind of busy with everything else. And she called me and said, I really think I want to have something done. And I'm like, oh my gosh, yeah, of course, come in. And so she came in, we did a mommy makeover, and she was very happy. And she came to me and she said, I didn't know that I deserved to feel like this. I didn't know that it was okay for me to seek this for myself. And I was like,
you're going to make me cry.
Yeah, it was just so, so powerful. And I was like, the ability to align how you feel on the inside with how you look on the outside is super, super powerful. And it doesn't mean that you should chase every trend and fad and whim, but the ability to control our own bodies and our own destinies in that manner is just super, super important. And that's one of the things I'm really passionate about.
I love that. That's so beautiful, Dr. Williams. That's such a beautiful story. And I talk about these transformations on the show all of the time because I talk about myself and how my surgery gave me the confidence to be able to even launch my show and believe that I was worthy of having something to say enough for my girls to listen. Or that was such a huge part of my upgrade.
Yeah, and we're coming from a time where I think people, in one ear, they're hearing, well, looks don't matter, and don't be shallow, and this isn't that important. But in reality, that's really not how human beings work. And we are actually made to care about appearance because we're social creatures, and that social connection is really, really important. And it doesn't mean that you should do things because the world wants you to, or because on that fashion magazine that you were walking by the grocery store said that you need to have these measurements. Absolutely not. But there's a self-confidence that comes from aligning that inner appearance with the exterior appearance. And so that's really my passion. And that's what I'm sure your guys' passion is for the people you interact with as you're spreading your message.
Absolutely. Actually, one of the main reasons, or one of the things that really aligned me with Laura and the POP recovery system was I have phone calls every day, and I talk to women from across the country, and I get to hear their stories, some successful a lot of successful stories, a lot of botched stories, a lot of I wish I had found you before, a lot of those type of moments where they're really looking for information. And another part of those conversations was me talking to women who are post-op surgery and are experiencing mental health, post-op blues, but it's lasting a little bit longer. And I actually had a patient that I was 6 months post-op. She was not seeing in the mirror what we were seeing in her results. Like, it was just, she still didn't feel beautiful and sexy. And I sent her over to Laura for mental health coaching. And I was so excited to receive a letter from her a few weeks later telling me how empowered she felt and how amazing it was to be in a community of women who supported each other and really sought after each other to just care for each other and try to empower each other in these journeys, in these moments where you can feel kind of lonely. You can feel like, am I being vain? Am I, being, the word
superficial or something
superficial.
Like that.
Yeah. Am I being too much?
Yeah. And all these things I've said, in the negative parts about the internet and social media, that's one of the positives, right? It allows, these communities to form and to reinforce positively each other and to support each other, through the whole journey. And I think, again, as a plastic surgeon, we are very, very conscious about screening people and about supporting people afterwards. And a lot of that is, making sure that people are in a good space mentally and they have the support systems around them. But we're not as good maybe as a counselor who does it all the time. And so these types of systems, like, again, what you've created, Laura, is really critical because it augments what we're able to do. And what it does is it means that our patients get better results. They're happier, they're safer. And so, and again, I give both of you a lot of credit because just like in my space, there are people who are kind of doing it the wrong way. There are definitely recovery systems that are not doing it the right way. And when I look at the fact that you have mental health, you have nutritionists, you have kind of all these pieces together to help support the patient through their journey, I know that you're doing it the right way. And so again, I kind of applaud kind of those things you put together, and we should work more closely together. I have no idea why it's been so long since we've really kind of had these conversations, but we should do a lot more together because I think what you're doing is great.
Absolutely.
Yeah, I agree. And one thing I want to touch on really quick that you said that went, oof, as a Black woman, my ancestors have not always had control over their bodies. And so when I see my women, my demographic being, herded like sheep to the slaughter to these not board certified plastic surgeons, it gave me even more of a fire to just give more education on why you shouldn't just do it based on likes or views or follows, but really dig deep into research. And if you don't have the time for it, or because you're working 3 jobs to pay for this surgery, which maybe we should talk about that, then hire someone who can do it for you. And our goal is only to have moms and daughters and wives and go back to their families after having an amazing surgery experience. And as great as the surgeons, board certified plastic surgeons can be, there's no way for you to know that this particular patient went through childhood trauma that being on that table is going to trigger. And
Yep.
so that's why we decided to patent our recovery systems, because of those fake systems that are coming out, so that we can cease and desist that tail when the time comes.
I want to touch on a point that both of you guys have brought up, and actually, I really want to hear about your experience, Dr. Williams. I saw that you were the first African American to graduate from the Yale program, plastic surgery program. How was that experience for you?
Yeah, again, I look at all these things as they're both good and bad. It's an amazing honor to have been the first. It's an amazing honor to be the first African American president of the American Society of Plastic Surgeons. But it's also sad, right? I mean,
because it's 2023.
Yeah, ASPS has been around for almost 100 years, and that seems like a long time. But we have to take all of these things one step at a time, and I'm obviously a very strong proponent of diversity and making sure that people are heard and people have equal access. But it's my job to be a good surgeon to everybody all the time. But I do find that that women are also generally not heard in healthcare, and so again, as a Black male, I would definitely have an affinity towards those struggles. But women also, it's amazing the times that I've seen or read about or talked to colleagues or talked to patients. So they've gone into, an internal medicine doctor and say, hey, I've got this, this, and this. And the doctor turns to the husband and says, well, tell me about her symptoms. I'm like, what? The patient is right there. And so when we think about diversity and equality and equity, it's not just necessarily a racial thing. It can be a geography thing. Rural areas tend to have less board certified healthcare providers of any type. It can be, what gender you're born into or what gender you identify with. Women tend to be discriminated in healthcare, in all honesty. And if you look at the results and if you look at the outcomes, worse than their male counterparts for the same issues. Well, why is that? That's something that when people say, oh, well, DEI has gone too far and diversity is, it's too much. It's like, let's start with the basics. There's still a problem. And, and I'm not saying that every part of society has to slot into these demographically appropriate numbers, but there have to be relative equivalences, at least in terms of outcome, when people go to seek for care. Otherwise, we're missing something.
Yeah. Would you say that if we were to look more at the best person for the position rather than because at POP, we're extremely diverse from all over the world, different colors, shapes, everything, and I didn't do that on purpose. We were looking for the best person, the best qualified person. How do you think that they're going to be able to do that in healthcare? Like, is there enough coming through in the next generation of diversity to be able to do it that way? Or is there need to be an education on those who may be interested in this career to force diversity for the generations to come?
It's a great question. And I think that anytime you have kind of this large societal issue that affects people at multiple levels and has an incredibly long cultural history and then is ingrained in ways that we probably don't even fully understand yet, I think it's challenging to say, well, here's the program that we need to institute to make it all better. What I think is more important and probably a better part of the solution is, just like we're doing today, each and every one of us just has to have a conversation and has to recognize the value of all of us. And it's hard. It's hard to sometimes say, you know what, I am going to say something. I saw that seemed kind of weird. Let's just have a conversation about it. And I think, and people have done that to me. And said, hey, you said this. Is that what you really meant? I'm like, you know what, that was insensitive. And it's not about, again, there's a lot of criticism that people take things too far. Or people don't give people the benefit of the doubt and just immediately are looking for that clickbait or that kind of like, I just want a chance to just, aha, I caught you, now I'm going to say something about it. I think when it comes from a good place, when you're like, look, it's a small planet. We're all here together for, probably a relatively limited time because lifespans are short. We just have to support each other. And I kind of go back to the fact that we all have more in common with each other, especially in the United States. We all have more in common with each other than we have differences. And so it's about listening to the other side. And some of my best friends are people who, really have very different political viewpoints than I do. And some of the best conversations we have are when we're actually sitting down and being honest with each other. And it's not necessarily about changing someone's opinion, but it's about understanding, because if we see each other as people, and if we understand other people's perspectives and not say, well, it's my job to change what you're saying, a lot of times that progress that we're all looking for comes naturally.
That's beautiful, because I 100% agree. I agree with that. So, Dr. Williams, if our girls want to come see you, where can they find you?
Yeah. And so, again, we're in Northern California. We do work with people from around the country. I'm a general cosmetic plastic surgeon, meaning that I do kind of from head to toe, every part of the body. We're known for body contouring and mommy makeovers, breast work, but we do facelifts and things like that too. We can be found online at Tri-Valley Plastic Surgery, because I think, again, plastic surgeons have to be on social media to kind of combat some of it. You can also find us at Tri-Valley Plastic Surgery, or I'm Surgeon in Black. That's my Instagram.
Oh, I love that.
Yeah. And like I said, we're really looking to kind of continue to partner with innovative people that support our patients. So, hopefully Laura and I will be able to kind of connect more in the future and become a resource for the people that you guys are serving as well too.
Laura, where can our audience find you if they want to come see you?
Yeah, so you can find us at poprecoverysystems.com. You can also find us online at Pop Recovery Systems. And we've also extended to start helping bariatric patients going through skin removal and major body contouring. So I love that that's what you do, like body contouring, that you guys specialize in that, because we have a wave of patients that are looking for board certified providers with our help. And our goal is to align not with every board certified plastic surgeon, but with the few, because unfortunately there are only a handful in each, region that are open to expanding, because it's new. Having something like this is new. And I know surgeons are very protective over their patients, as they should be. But I love that we can expand on what the surgeons are trying to do, because you can't be everywhere at once, but Pop Recovery Systems is expanding so that we can be. So you can find us on Instagram, find us online. And if you ever have any questions, you can always DM, and we look forward to working with you, Dr. Surgeon in Black. I love that name. I was like, okay, Surgeon in Black.
Can I ask you guys one last question?
Sure.
What do you guys think of the semaglutides and this kind of medical weight loss? Because we are seeing a massive wave in that. And I think that we've started offering it to our patients, and we found it to be really, really positive. And again, we're kind of thinking about parts of the population sometimes that don't get heard as well. We especially want to start, offering those services to those types of patients, because again, weight loss is one of the things that everyone has struggled with. And it's, when Oprah comes on and says, well, maybe it's not all diet and exercise. Like, oh, thank you.
Finally,
Finally,
tell us the truth.
That's great. So what do you guys see the patients that you're interacting with? Are they looking for those types of things, or how are they finding access to that? Because again, that's a whole thing. It's like, oh, I'm getting my drugs from Mexico. I'm like, what? Okay, are you really? I mean, like, it may be labeled as that, but it may not be. And so are you guys finding patients that are seeking those solutions too?
I actually am. I'm seeing a lot of patients, but also surgeons' offices who are offering it as a solution for their patients, because sometimes, and we talk about this on the show, when somebody comes to see you for the first time, they're not at the right weight, or they're at a weight that's a little bit too high to do surgery, elective surgery safely. And I feel like those people have an answer. Like now they have an answer, because they can actually start working towards getting to their goal weight so they can have the surgery that they want to have. So I'm super excited about it. I've seen a lot of patients around me who have had amazing results, surgeons who have been on their semaglutide journey, losing tons of weight and just bringing it into their practices and using it as a tool. So I think it's amazing. I'm super excited to see it.
Yeah, I've actually used it myself to get to my goal weight for my surgery coming on February 26th. And, one thing that it has to be very careful when the patients are using it is their nutrition.
Yep.
That is very specific. So we actually created a system just for that specifically, because you do have to up your fiber. You have to make sure you're taking a prebiotic. And because I found that through my own experience, I was like, why is my digestion like a little different? But I started I was like the guinea pig. But we think that it's amazing because had I not had that regimen with the assistance of semaglutide, I specifically used Ozempic, I wouldn't have met my goal weight to be able to have my mommy makeover, which I deserve. And I wasn't going to let, that weight. But at the same time, I love the semaglutide because not everyone is in an obese range where they have to have like a bariatric surgery. But like phentermine, that's not really where it's at for its own reason. So I love that these injectables are becoming more accessible. I just think it's important that the surgeons that are offering it are also offering some kind of comprehensive plan to make sure that they're doing it the right way, because you can still do it the wrong way.
100%. And, again, this is the first class of drugs that actually works. I mean, I'm not saying phentermine or metformin or other things people have been on. I think they have helped people, but this drug works for almost everyone. I mean, it is amazing, you know, and this is really just the first generation. Like the generation 2 drugs are going to be out in the next couple of years, and they're going to be even better. But Laura, to your point, yes, there has to be a system. There has to be nutritional support. There has to be some behavior modification, because you don't want to be on these medications forever. And
right.
Stop them, that could bounce back. And so we should talk more about connecting.
We're going to talk more. I'm going to slide in the DMs. Okay. I definitely am, because it's growing. And even, I'm not sure if you know this, but Weight Watchers just bought Sequence, you know? So, but still the person who's like, for example, I have what I tell Mavi, I have what's called reverse body dysmorphia. Okay. I see Beyonce in the mirror every time. Okay. So I'm not going to go to like a Weight Watchers, right? Because in my mind, I don't see myself as obese. There's millions of patients just like me. So having them available in a plastic surgery office with a comprehensive plan, it will allow you to expand on so many levels as a practice, but also offer more solutions to your patients. So I think it's super cool.
Wow, I love we're going to talk, Laura. We're definitely
that can be for another episode.
All right,
that's a whole hour episode on its own.
We're taking over your podcast. We're taking it over.
The semaglutide, I think, is a whole hour in itself, because it's been such an amazing tool for women who are really looking to get towards their goal weight. And even sometimes without surgery, they're maybe just losing 25 pounds will get them to where they want to be, where they're like, you know what, I don't even need surgery. And now I've learned how to eat so I can keep it off. And now I'm just going to continue working out. And so what I want our audience to know is that it's not always about having surgery. You can do other things to make yourself feel better and just healthier.
Yeah. And as a plastic surgeon, like, you don't have to have plastic surgery to feel good about yourself. And again, you should hear that from the president of the American Society of Plastic Surgeons. We want to be there for people who want it, and we want to make sure it's safe, but you can be completely self-actualized, self-empowered, and feel good about yourself without surgery. And so, I guess so. It sounds like we have a part 2 of this podcast.
Yes, we have a part 2. We'll have to do a part 2. So you guys stay tuned for part 2 of this episode, because semaglutide seems to be the modern wave of weight loss. And I think we should really deep dive into it, the different types.
That drug's going to change the world. I mean, it's one of these things. It's almost like AI. It's like, oh my gosh, this is going to make a massive difference in society and the health of people.
I love it. So we'll leave off on that note, and for the next episode we'll definitely bring that on. So thank you guys for coming on the show, and I will see y'all next week.